Good evening to all our viewers tonight, and welcome to the Ombudsman program. My name is Diane Welborn. I'm the Ombudsman, and I'll be the host for this evening's program. Tonight, I am really pleased to have with me, and for you all as well, to have our new Health Commissioner, Jennifer Wentzel, with me on the show tonight to answer questions about Dayton and Montgomery County Public Health Department. A very important department in our community, and particularly now, but even before COVID, it was a very important community, and they cover many programs and offer much to the public to help keep us safe and help keep the quality of life here as good as it can be. So welcome to the program, Jennifer. It's good to have you.
Thank you for having me tonight.
Yeah, my pleasure. I want to remind our viewers as well that this is a call-in show. And so if you have a question that you would like to ask our health commissioner, feel free to call it in. Your voice won't be on the air because we're doing this by Zoom. So when you call in, you will speak to the helpful staff and volunteers at DATV, and then your question will be sent to Jennifer and myself in the chat. And so we will pick them up that way. So great, Jennifer, I'd like to ask you a little bit about yourself, what you would like the public to know as you come into this new position, about your background and your credentials and anything else you want to add.
Sure. Thank you. I have 23 years of public health experience. In the last 20, I've been here with Public Health Dayton Montgomery County. The bulk of my experience has been environmental health. I started out in Public Health Dayton Montgomery County as an inspector, and I was in charge of the Central Business District downtown for doing food inspections. And then I was promoted to supervisor, and then in 2014 I took on the position of Director of Environmental Health and was overseeing about 60 staff members and a variety of environmental health programs in Montgomery County, including food inspection, air pollution, landfills, private sewer, and private water. So if you took a breath in Montgomery County or ate food, that fell underneath our office's authority. And then in December of this past year, I was appointed to the new health commissioner position. My background is I have a bachelor's of science in environmental health and a master's of public health, both from Wright State University. And then
Wonderful.
And then for credential-wise, I'm also a registered environmental health specialist, and I've been that since 2002 with the state of Ohio.
Wonderful. So glad to know all of that. And it's so comforting to have such a well-qualified and well-experienced person at the helm now as health commissioner. I bet you have a lot of stories to tell about inspections in downtown Dayton. So
Sure.
Yeah, I bet there's a lot going on there. I also understand that you've been very active with the Ohio Environmental Health Association, which covers the entire state, of course, and takes you into contact with others in your profession across Ohio. Why don't you inform our viewers a little bit more about what that association does and how they operate?
Sure. The Ohio Environmental Health Association is made up of individuals that work in the environmental health field in the state of Ohio. It can be private industry or state or federal or local government type participation. We promote our profession and promote the well-being of Ohioans through environmental health. So we promote and put on conferences every year in each of the corners of the state, as well as a state conference, and usually in April, where we offer continuing education to allow our membership and those others that want to participate the most up-to-date and current science on what is going on in our field. I've had the fortunate opportunity to serve on the board of directors for a number of years. I served a few terms as secretary and then served as president for a year. And I'm still remain active and chair to standing committees currently.
Good, good. That lets you be in contact with others in your profession and know what innovations are going on and what other people are doing and what other health agencies are struggling with as well, doesn't it?
It does. It allows us to share experiences. We can bounce things off of each other, best practices, and allow us to advance a little bit quicker than trying to figure it out on our own. So we share science and information quite frequently with each other and knowledge about what's going on.
Oh, that's great. It's a good opportunity. I'm glad you're still involved with that. Well, I know we have a lot to talk about tonight because there's so many programs at Public Health Dayton and Montgomery County. But before we go into the many programs that you all provide and the way in which you serve the citizens, I'd like to ask you if you would please give our viewers an update about COVID. That's at the top of the list, it seems, and top of the news hour. So tell us how we're doing here in Montgomery County, please.
Sure. Unfortunately, it's not great news that I have to share tonight. We continue to see an increase in cases in our community, just as others are in the state of Ohio. In the last week, our cases have increased 26%, which is considerable for us. Our total cases on a 2-week average are now 1,701. This is the highest peak that we've had this entire pandemic with number of cases. So that 2-week incident rate has increased 72%. So our trends are going definitely up, and it's concerning to us here at Public Health, as well as others of our community partners in the area, including our hospital systems.
Right, exactly. Oh dear. And how are we doing on our vaccination rates? Are we seeing more people coming in to get vaccinated? Has it tapered off? Are we busy vaccinating children as well? Give us an update on that.
Sure. Our vaccination in our clinics that we're offering are pretty consistent right now. We would love to see more of our children 5 to 18, specifically our 5 to 11-year-olds, be vaccinated. This will help keep our kids in school and keep them healthy. We have clinics twice this week for the community members if they would like to come in and get vaccinated. And these clinics are for those children that are 5 and up, and including adults. So people can come in and then get their first dose, their second dose, their booster. And we're also offering flu shots starting on Wednesday in our clinics. So you can come in and get both vaccines if you are interested. But definitely we can always do better with vaccination, and vaccination is our way out of this problem. So it's very important that we continue our efforts in vaccination and encouraging our community members to get vaccinated.
Okay, very good. And the CDC had some additional comment to make this week. It seems like it may have caused some confusion, but maybe you can clarify that a little bit about what the new times for quarantining are. I think that's what it was about, wasn't it?
Sure. So as we've progressed through the pandemic and with COVID, some things have been updated because the science has been proven and information's been updated to prove that science. So if you test positive for COVID-19, that means you have to isolate. So you have to stay home for at least 5 days. If after those 5 days you don't have symptoms, or your symptoms are getting better and there's no fever, you can leave your home, but you still have to continue to wear a mask for an additional 5 days. So that whole time period is a 10-day time frame. If you are exposed to someone with COVID-19, we ask that you quarantine, and that depends on where you are in the vaccination process. If you've been boosted, you can continue about your activities, but we still ask you to wear a mask for 10 days. If you are not vaccinated, you have to stay home for 5 days and then continue to wear a mask for an additional 5 days. And if it's possible, then you would test on that day 5 to see if you are positive or not.
Okay. And I also wanted to ask about a bit I heard on the news about the government sending free testing kits through the U.S. mail. I didn't catch the whole story, but that might help with people being able to test right there in their own home and not have to go somewhere physically to do it.
Sure. We're still waiting on the federal government to roll out the details of what that program looks like, but I understand that the community could sign up through a certain website and then they could receive the test through the mail, but we're still waiting on all those details to come through.
Okay. What do you think, or what is the health department's position about the major weaknesses that our community needs to address with respect to COVID?
So there's been many challenges through this whole time frame with COVID. One of the biggest challenges is misinformation. So it's important that everyone stay up to date with what's going on currently in the news and what's going on with COVID. We provide up-to-date information on our website, and we also have a call-in number during normal business hours that the community can call in and ask questions. And that number is 937-225-6217.
Very good. I'll probably ask you to repeat that again by the end of the program in case somebody tunes in during this hour and they didn't hear it the first time.
Sure.
We do have a couple of questions that have come in from viewers, but first of all, viewer wanted to thank the commissioner and your staff for all of their hard work. So you all are appreciated. Next, there's a question asking, are there currently any incentives for first-time vaccine recipients? I think they may mean adults.
Sure. Unfortunately, our incentive program expired on December 31st. We do not have any funding currently for it, but if it becomes available, we will offer it again. But unfortunately, at this time, there are no incentives.
Not now. Okay.
Correct.
And also we have a question asking whether there are free health tests available at the public library.
The library has been carrying free tests. However, those tests tend to go very quickly when they are supplied with them. So it's best to call ahead and to see if they have any.
Okay. Yes, that's always wise to do, is to call ahead. Is it your agency that's supplying the tests to the library?
Yes, we are supplying tests as well as the state of Ohio, the Ohio Department of Health.
Right. So they're coming from several sources then. Okay. Okay. I want to now move into talking a little bit, unless you have something else to add on COVID.
No.
We may yet get some more questions from viewers because, like I said, that's what everybody's talking about. And currently, do we have any schools that you're aware of that are not in session because of COVID?
I believe the media is reporting a few are moving virtually for a day or two, but I haven't heard anything concrete from them directly. But okay. I believe most of our schools are still in session.
Okay, that's good. Another question that is being put to us is what the ratio is for COVID among ethnic groups in the region.
So I just have a couple of numbers that are handy to me. Right now, Blacks have the highest current case count, followed by those that are white. Case rate.
Okay.
Followed by those that are white. And then whites have a higher case count, the opposite, followed by those that are Black. So it's a little reverse, but if I can share the numbers and maybe that could help put it in perspective. The case rate is 1,838 per 100,000 for those that are Black, and for white it's 1,084 per 100,000. Okay,
thank you. I think that does help clarify that a bit for us, for people with all of that. Another question that has come in is off of COVID now and moving into, or sort of off COVID, that the use of community health workers and the significant role that they have played in the community. And they're asking for how community health workers are working with populations during this current pandemic.
Sure. We have community health workers in a variety of positions within the health department, just with our day-to-day operations. So we rely on them to share information about vaccination and how to stay healthy out in the community. But we still rely on them to continue the good work that they're doing.
Okay. And another viewer wants to ask, how do you gather statistics for at-risk populations for COVID?
Sure. We gather statistics from a variety of sources. The Ohio Department of Health has a variety of information on their dashboards on their website that provide information that we utilize. We collect our own information. We talk with our hospital systems and collect information from what they do. It's from a variety of sources that we pull together. On our COVID information page on our website, we have a data page that you can see a lot of that data for what's going on in the community and the state around COVID.
So there's a data page on your website for people who want to follow the statistics on that.
Yes.
Okay.
Yes.
They would just, why don't you give the website for the viewers, and then they can check that out themselves and follow it.
Sure. Our website is www.phdmc.org. And at the top of the page, there is a COVID vaccine button, and then there's a COVID general information button that you can click on to take you to that information. Okay.
Thank you. That's wonderful. Another caller was kind of circling into the environmental health topics and asking the main environmental causes of any serious health problems that we have in the Miami Valley, such as cancer, for example.
Sure. We monitor those numbers as well to see the prevalence of cancer and types of cancer in our community. Our environmental health programs work diligently to reduce those causes. So we have Radon Action Month coming up. So if you're interested in having your home tested for radon, you can go to the Ohio Department of Health's page and get a free test kit to test your own home to see if you're exposed to radon. So there's a variety of activities that we do to keep an eye on what that looks like.
So a person would just contact the Ohio Department of Health and ask for the free radon test? Is that how
Correct.
That works?
Yes.
Oh, okay, very good. Do we know how many people in our area are using that, or where are there pockets where people are at risk of radon? It's not everywhere, is it?
Ohio is generally a state that has radon, and you need to be aware of it. So it's always good to test and understand what your risk is. If you're a smoker, you increase your risk for lung cancer, and radon compounds that and makes it worse.
I see. And what would a person, certainly stopping smoking is a good idea for lots of reasons, but if a person does get that positive radon test in their home, what steps would they need to follow up with after that?
It would be a good idea to contact a professional, a radon professional, to address next steps of how to remediate that radon from your home. They would have tips and tools to be able to reduce that risk in your home.
I see. Okay, very good. I read that your agency, in order to fight health disparities that exist all across our country, so we're no exception there, that you all have produced a lot of materials available in different languages. Would you like to highlight any of those?
Sure. Many of our programs and services have information translated to different languages. And specifically with COVID, to help to dispel some of the misinformation out there, We have multiple videos that are available for the community to view in different languages.
Okay, very good. I think one of those myths that at least I've heard repeated is just that the vaccine is just not safe. How would you address that concern?
Sure. I would encourage that person to talk to a medical professional, someone that knows their medical history, and discuss what that looks like for them. But with the vaccine, we are seeing that it's reducing the severity of illness in the community. So we feel that the vaccines are a very important part in stopping and slowing COVID.
Okay, very, very good. And therefore, it's just so encouraged for people to get that vaccine. Nobody wants to get this disease.
No.
No, nobody wants this. I saw in your newsletter, which I do read a monthly newsletter, it's very well put together, that the American Rescue Act has made even a death benefit available through FEMA. And that viewers might want to contact them if they're interested in taking that benefit of if they've had a death and they're needing to pay for expenses. Do you have more information about that for us tonight?
Sure. The assistance is a $9,000 benefit that every American family is entitled to, regardless of their income, if their family member passed away of anything attributed to COVID-19. If they're interested, they should call FEMA and have the loved one's death certificate and receipts available when they call FEMA. And that phone number is 844-684-3. I'm sorry, let me start over. 844-684-6333. And that will get you to FEMA and they can assist you with that.
Okay, I had no idea that was available other than reading it in your newsletter. So that's good information for people for whom that might be an unexpected burden that has come up. Are we still seeing that the cases that are requiring hospitalizations are primarily those people that are unvaccinated, or do we have vaccinated people also requiring hospitalization?
Sure. In our region, about 83% of those that are in the hospital are not vaccinated. And then that number is even higher for those people that are in ICU at 89%. Wow. So we are seeing that vaccine have an effect with less severity on people. So again, it's very important to consider vaccination.
Yes. And the people in the ICU, of course, every person has their own health background. There could be any number of ways in which COVID can negatively impact a person, but it seems like the primary reasons are around the lack of ability to get air. It seems like primarily it's respiratory reasons.
Sure, correct.
Yeah, okay. All right. Is there any update that you have for us about when there another booster coming or another vaccine that's coming down the pike?
Not at this time. We don't have any information on that. They're still being researched and looked into by the manufacturers and the government. Okay.
So that's still in the works, but it's not something that's happened yet. And
correct.
We don't know when we're going to see that, but I'm sure you'll be giving them out as soon as you get them. So
yes.
Okay. I think that we in Montgomery County are really fortunate to have such a large local health department. Why don't you tell our viewers a little bit about the department, its budget, where the budget comes from, how many employees you all have, that kind of stuff.
Our annual budget is just around $37 million, and about 46% of that comes from our human service levy, one of the levies that we just passed in this past November.
Yes.
And then the remainder of our funding is based in a combination of areas, grants, fee for services, license and permits that we provide. And then we have roughly about 300 staff on our payroll with over 50 programs and services offered in our community.
That sounds quite large to me. How do we compare with the other large counties in Ohio, or populous counties in Ohio?
So we have this saying, if you've seen one health department, you've seen one health department. So they're all different and unique to the communities that they serve. But we all offer foundational programs that are mandated by the state of Ohio. And then we offer additional programs and services that are needed by our community based on what we see through our community health assessments.
Okay. And how frequently are those health assessments done?
Our community health assessment is performed every 3 years. And then we also do a community health improvement plan that helps lay out the framework to improve the health of our community based on what we see in the assessment.
Okay. And that assessment is conducted by, in what ways do we conduct our assessment to get that?
Sure. We collect data from a variety of sources, as we talked about before. We talk to our community, we hold focus groups and ask pointed questions about what is happening in the community. So our community health assessment is very data driven on what is going on in the community.
Okay. And where are we in that 3-year cycle? Is there one coming up soon, or?
Yes, I believe we are underway for our next community health assessment. So we should be seeing something soon.
Okay. We'll be getting some more about that. Another question that has been called into us tonight is that a viewer wants to know about health disparities, and how do you track or study if there are any increases or reductions, and are we making improvements? I think that's an excellent question. I think it's also kind of broad, so I'll let you take it in its broad form, but then maybe if you could take one example of a disparity and how you track that, it might help answer the question more completely. I don't know. I'll leave that to you.
Sure. Again, we collect data from a variety of sources, hospitals, what's going on in the community from our own experiences, talking to our clients that come in and ask for services or receive services. So that data there's a lot of data out there. So we take that, we have an epidemiologist group that takes that data and interprets it for us to help us see if we're making improvements or not. One of the health disparities that we are looking at right now is infant mortality. And preliminary data shows that we're improving our infant mortality in the community, which is great. We want all of our babies to live and thrive, and to reduce that rate is a huge accomplishment. So our staff is working diligently to move that mark lower in both white and Black babies.
Right. Very good, because we were ranking pretty high there a couple of years ago, were we not?
We were, and we still have some room to come down. We still have some improvements to make, but to see the needle come down a bit is very encouraging for the work that we are doing, as well as our community partners.
Okay, and what other type of disparities might you like to highlight?
We look at access to food, making sure that all have access to food. We have a food equity coalition that works with our community partners to help improve access to food, and we are making great strides in that as well. Okay,
well, that's very encouraging to hear. And what are some of the major factors impacting the environmental health in Montgomery County?
Sure. So we continue to see improvements in air quality. We currently meet all of our health-based air quality standards set by the EPA. And then over the last several years, we've been working with industry to transition all those facilities away from using coal to natural gas for fuel burning. which
Okay.
then results in less pollution and improves our air quality. And then we've also seen the increase in use of more fuel efficient cars and trucks, which is also helping to reduce air pollution.
Are you, how do you all counter any resistance that you might have from a company to make that switch? How do you educate them?
Just by doing that, educating them, showing them information and data, tools that they could use, and allowing them to see, or providing them to ideas to make better improvements to their facility. We do that through writing permits and inspections.
Okay. So how often are places inspected for air quality?
It depends on how their permit is written, so it can vary depending on the type of facility it is.
Okay. Yes, air is, you've already said that the quality of the air is improving in our area, and that's very positive things. What are some of the initiatives, in addition to moving away from coal, what are some of the major initiatives for us with our air quality?
Currently, we're working towards pursuing improved equipment for air monitoring and sampling. So under the American Rescue Grant Plan, we are applying through the Ohio EPA to the federal EPA for additional funding to replace some of our older air quality samplers with newer technology that will allow us to better fine tune what we are seeing in our community, specifically with fine particulate matter in our air. Over the past 2 years with COVID, we've also moved away from doing on-site inspections, and staff over the last few months has been back in facilities to do on-site inspections. You see a lot more than you would doing a virtual inspection. So as we saw the stay-at-home orders lifted, we are now back into facilities more and getting back to where we were doing inspections.
Okay. And what type, the inspections for air quality, do we have devices just out and around located in certain parts of our community that are measuring air quality on an ongoing basis?
Yes, we do.
Okay.
We do. We have air monitors located not only in Montgomery County, but we are also responsible for surrounding communities and counties. So we have air monitors in there, because the air just doesn't stay in Montgomery County, and air just doesn't stay in Miami County. It moves around. So we have monitors set up to capture a little bit more accurate picture of what we're seeing in our region.
Okay. And do those monitors have a long life, or do they have to be replaced frequently?
They have to be replaced. We have a good team that takes care of them and watches the maintenance. So we do a really good job of upkeeping them. But as technology changes and is improved, we have to replace our equipment.
Right. And also, are these air quality measuring devices, do people have to go out and actually take the measurement from the device, or does it automatically report it in somewhere?
A little bit of both. So we make sure that our information is being transmitted correctly and monitors correctly. So we do a lot of quality audits to make sure that that information is being transmitted as it should, and the machines are running properly. So we do on-site as well as the monitoring here in the office. Okay.
And when you're monitoring air quality inside buildings, which ones, what types of buildings are you going into?
We currently don't have an indoor air program.
Okay.
We eliminated that a number of years ago due to funding sources.
Okay. So there's not anybody coming in and monitoring air quality inside. Is it monitored inside businesses or like plants where there could be a potential, or we don't have that anymore either?
We don't have that anymore. If it would apply to a permit through what RAPCA issues, then we would take a look, but just the general air quality, there is no program for that.
Okay. And are we seeing some reduction in the types of pollutions that come out of vehicles and trucks and cars and all of that?
We are. So as we see the new car fleet updated every year, we are seeing improved controls on pollution too.
Okay, well, that's a good thing. Well, is there anything else you'd like to comment on about air?
I don't think so. I think we've hit most of the highlights.
Okay, good. Thank you. Well, then, in addition to air, everybody's got to have water. So, and there's certain places, of course, in our nation that have had terrible experiences with their water supply really not being fit to drink or even being dangerous to drink. So, why don't you talk to us a little bit about our drinking water? Have we been successful in removing chemicals from the water, that our source water or our aquifer? Have we made good progress on that?
Sure. We have two different types of water programs here in the county. We have a private water, and then we have public water. Private water is those people that have private wells on their property, and they're responsible for the upkeep and monitoring of their own drinking water. And then we have public water, which majority of our county enjoys, where we buy water from the city or the county or another local purveyor. We turn the water on and they're providing us that water service. So our local water purveyors are constantly monitoring our water supply. And currently our water supply is deemed safe, where we meet all of our water quality standards.
Okay, all right. And if it were not, or if there were something, if a problem were noted, what would be the role of your agency with respect? What would happen? What would that trigger you to do?
Sure. It depends on what the problem is. In some cases, if we're notified that there's a concern, we will work with that purveyor to come up with some language or offer guidance and direction as to what actions need to be taken. If you remember, a couple years ago, we had a large water main break within the county. In addition to the tornadoes that we had water interruptions. So we provide information on how to boil your water, or finding a potable water source or safe drinking water for your home. So we would help encourage messaging and offer that information to the community on how to consume safe water.
Right, how to make your own water safe if you have to boil it, right?
Correct.
Yeah, I do remember that water main break was almost under the river or something, right? It was in a difficult place to get to get. So if viewers or others have questions about the safety of their drinking water, is your agency a resource to answer questions about that?
We can answer general resource questions about what they're seeing or possibly seeing, but we would encourage them to contact their purveyor. Their water purveyor, or the person that they're purchasing the water from, would have the most current information of what's going on. But we most certainly can address some questions to get them started.
Because they are also responsible for monitoring, and it seems like your agency is kind of maybe a double check or an extra check on that for reassurance about the safety of the water.
Sure. Yeah, we want to offer as much information as we can, and we try to answer questions as best we're able to.
Okay. And what kind of threats do we have, or are we ameliorating when it comes to our waste disposal? Because we produce a lot of waste in this country. So how are we making sure that that's being done safely and correctly?
Sure, we have a program, and as well as the Ohio EPA, that monitors our landfills and our waste stream. So we have a set of rules that we follow to ensure that the waste is being disposed of properly and safely to help protect our water system.
Okay. And the only area that is not inspected is the private wells on private property. Is that correct?
We would issue the permit and then do an inspection for when it's first drilled to make sure that it's installed properly. Once the well has been passed and approved, then it becomes the homeowner's responsibility for upkeep and monitoring. We would offer guidance and direction on how to do that safely. And then we would also offer them education on the frequency and how often they should test their own wells.
Okay. And do you have any idea about how many wells there are? Are there still a lot of people using well water in Montgomery County?
I don't have that exact number, but I think it's more than we realize. They could use it for drinking water. They could use it for irrigation for their yards, and it's a variety of sources. So,
right. It'd be very difficult to keep account on that. So, okay, I want to move now to talk a little bit more about the healthy lifestyles that, because your programs are so diverse and there's so many. Talk to our viewers about the way that the agency approaches promoting healthy lifestyles.
Sure. I will talk a little bit about Carepoint. That's our syringe service program.
Okay.
It's a very fantastic service because it wraps services around the individual. It helps those who inject drugs reduce the chances that they will harm themselves and others by providing a clean syringe to them. So it's a one-for-one exchange program. We also do through that program referrals for substance abuse treatment and other health and social services. Condom distribution to prevent the spread of HIV and STDs. We help with Medicaid sign up, and then we do free testing and education also, whether it's HIV, pregnancy testing, or hepatitis C. And then we provide information on gambling addiction. So the person would come into our system, they would do a one-time confidential questionnaire, and then we would help assist and get them to the services that they need.
Okay. Yes, and I'm sure that's been big, and we'll come back to the opiate problem, which was a major problem before COVID even hit us, wasn't it? So we'll come back to that in just a second. But the healthy lifestyles are also, I'm sure, promoted through the Food Equity Coalition and the work that they are doing. Would you like to say a little bit more? I mean, that's a very important coalition and actually quite large, isn't it?
It is quite large. So we have a project manager here at the health department, and they work with our community partners to address the needs of food in our community. So we take a look at where food is available and not available, or healthy foods too, and try to link people with appropriate services and providing those foods to those that need it.
Yeah, that's really such an important program. And as one goes around town, you can sometimes see the food delivery being made at different senior citizen centers where they may not be able to get out and get somewhere to get some healthy food. So that's a really important initiative, I believe. Do you know what's next on that horizon for the Food Equity Coalition?
I believe they're still working on programs and services about what that goal is. So I can't speak to that right now.
Okay, well, we'll be watching for that in the future then. That's just great. And minority health matters. Why don't you say a little bit about how the agency helps to support minority health?
Sure. We have a local office of minority health, and they work to out in the community to engage with those minority populations to bring services to them and to best understand the needs of that community. Okay. One of the programs that our local office of minority health is doing in January, every Wednesday they are doing a post-holiday physical wellness series with a wellness coach, and they are coached on the physical and mental aspects of investing in yourself and your well-being. And if you complete some of those series and complete the feedback surveys at the end, you can be entered into a drawing for $150 grocery shopping opportunity. So We have programs that are ongoing and some that are just short-lived within like this month of January. So those are opportunities also, and that information can be found on our homepage on our website.
Is it too late for somebody to like go this Wednesday and start?
No, it is not too late. So the information is released on noon on Wednesdays, and it's I believe, a YouTube video, so you can go back and watch the previous weeks.
Oh, well, that's good to know. All right. So that's also all available on your website. Very good. How does your agency then reach out to vulnerable populations? We spoke a bit about infant mortality, but there's lots of other things that go along with infants. Why don't you say a little bit more about your agency's work to protect that vulnerable population?
Sure. So we have a WIC program that has just recently expanded programming. So we are now at the Marilyn E. Thomas Head Start facility in Trotwood on the third Wednesday of every month from 1 to 5. So that has been open, I think, 3 weeks now. So we're able to provide healthy foods to pregnant, postpartum, and breastfeeding women, and infants and children up to the age of 5. So we are also always accepting new enrollments and encouraging them. And then we're also able to update their benefit cards for those families too.
Oh, that's wonderful. I'm sure the response has been good in Trotwood, hasn't it?
Yes.
Yeah. People are coming in. What day of the week again is it?
Wednesday.
Wednesday. Popular day for your programs. They're middle of the week. That's a good.
Yep, the third Wednesday of the month.
Okay, well that's a good time to do that. What about reaching out to seniors?
Sure. So one of the recent popular programs that we have is Tai Chi for arthritis.
Really?
Yes, it is done online through Zoom. It's an 8-week program, and we have a limited number of signups, but we do have a wait list. So you can contact our health department if you're interested in pursuing that as a senior.
Oh, great. So it's done on Zoom, but it's kind of full now.
It is.
But how long is its duration? And then when can those on a wait list, does it go for X number of weeks and then people on the wait list can start a new class, or how does that work?
Right. So it's an 8-week program, and each of those classes is an hour long. I would encourage you to sign up if you are interested as soon as possible. So if it remains popular, that we would still continue it.
Okay. Well, that sounds, so you have to evaluate everything we do, being researched and research driven. You want to make sure that it's achieving the goal there. Well, I didn't know about the Tai Chi. That's something new. Okay. Do you have a lot of seniors taking part in that?
We do, with full classes, so I would imagine.
Yeah, oh, good to hear that. Great. Now, another important part of your role of your agency is to be skilled and available to have emergency responses. So why don't you talk to us about how do you handle, when an emergency emerges? By definition, you can't really plan for that particular emergency, but you've got other plans in place. So how does that work to protect all of us?
Sure. So we practice. Practice makes perfect, or close to perfect. We have a program, emergency preparedness program here within our health department. And fortunately, we practice frequently to make sure that we have what we need in case an emergency pops up. Do we have the necessary people? Do those people have the training they need to address whatever is presented before us? It could be something as simple, not simple, but the water main break, one incident where we had to bring people together and respond and out into the community to make sure that our businesses had the tools that they needed, and our community members. We responded through the tornadoes with an emergency response presence. We offered birth and death records out into the community. So with the birth records, those people that were impacted and lost all their documentation, at least they could get a birth certificate to start that process and rebuilding the documentation that they needed to start their lives again or restart their lives.
Right.
So we're always staying abreast of what's going on in the community, and we're able to adapt and respond. We have a core group in the health department that are leaders and very well trained at what they do to make sure that we can offer the services that we need to an emergency while still at the same time offering the services that we are committed to offering here in the health department. So our staff is very diligent, and they are very good at what they do and offering those services. And we've been busy for the last 3 years.
Yes.
And I appreciate them greatly, if I can say that publicly. Yes. They do fantastic work, and I appreciate their response and their roles. And I enjoy coming to work to see them every day, because we hit the ground running and we do it again. So
yeah, that's good. Well, thank you on behalf of us and all of us that live here. Then you've also your agency has had a really hard time with the opiate problems that our community has experienced. You mentioned already the Carepoint, which is the syringe exchange, and say a little bit more. Say a little bit more. Is the overdose action team still in operation?
They are very much in action. Unfortunately, our unintentional overdose deaths have increased the last year or so due to COVID, we believe.
Yeah.
So we continue to work with those partners in the community overdose action team, or our COAT, to provide services to those that need help or need a little bit more assistance, as well as our addiction services program here at the health department. And we use outreach teams that attempt to link those that have overdosed or have a risk of overdosing to the services that they need, similar to the Carepoint program. Okay. We also offer and provide opiate overdose prevention education and distribute overdose reversal kits like Narcan to those community members that are at risk. They have to complete a training, and that would also apply to family members who have others that are at risk, and they want to make sure that they're able to help them. So that is also available to those that are eligible here in our health department.
All right, that's very important work, and work that's saving lives, and that's important to do. We hope that will pass for us as well. Then tell us a little bit about the role in vital statistics, because that's another responsibility of your department as well.
Sure. Our Vital Statistics Office offers birth and death records to those that were born in the state of Ohio. Our window is open here at the health department, or you can phone in or go online to get your birth or death record. I believe records go back as far as 1909, 1908 for both of those.
Wow.
So we have a wealth of information through our Vital Statistics Office.
Okay, very good, very good. Thank you. And then I read with great interest, I think you do some inspections with respect to tattoos.
We do. Okay. So we have one of the oldest body art tattoo inspection programs here in the state of Ohio. Our program was modeled at the state level, and then eventually the state adopted what we were doing here in Montgomery County. So now we have statewide rules and regulations for tattoo, body art, and piercing artists in our community. So we make sure that they comply with the state regulations. We go out and do inspections 1 to 2 times a year to verify that their artists have proper training and proper education, and that they're providing it in a sanitary manner. And then we also follow up on all complaints of unlicensed tattoo artists operating out of homes. So
okay.
It's quite an interesting program.
Yes, I'm sure it is. I'm sure that those that working in those programs also have a lot of tales to tell.
Sure.
That would certainly be one. Jennifer, our time has really flown. We are coming down here to the very end, so I would like to give you the opportunity to make any comments on the work of your agency about which I did not ask or didn't know to ask, or if there's something new that you would like to announce or that you would like to make sure people know about before we have to go off the air.
Sure. Our website provides a wealth of information to those that are looking for bits and pieces as to what the health department does. On our website, you can find information about all those facilities we license and inspect. We post the complete inspection report online, so you can take a look at your favorite tattoo shop or your restaurant to see how they do on their inspections. Our clinic for immunizations is also available to those that need specific immunizations or shots for travel or for school-age children. We are also offering flu shots in our clinic too. So we encourage you, if you need a shot or an immunization, to contact our clinic.
Okay, thank you for that good information. I want to express my appreciation for your coming on to the program and talking about your agency and the touch. I feel like we kind of bounced around on the top, to hit the top level of a lot of things that you all do, because it's so much. I also want to thank the viewers for their good questions, for calling in. And so thanks to everyone, and we'll have to sign off now. Until next month, bye-bye.